From UBN Studios, you're listening to Unsugarcoated with Aalia, bringing you interviews with public figures and inspirational people speaking on self-improvement with empowering themes. And I'm your host, Aalia Lanius. Hello, and welcome to another episode of your favorite social good talk show. We are so happy to be back with you. And you know what? Well, happy and a little sad. I cannot lie, because today's episode is the season finale of Season 11. We are so grateful for all the people that have joined us thus far in their conversations, in the value that they've brought. And I hope that you've been inspired and served through the conversations that we've had, all in an effort to promote emotional intelligence to you all so that you can serve yourself, your family, your community. And today's conversation is going to be talking a bit about preventative healthcare. And I'm excited that our guest is here to talk about AI, genome, and what preventative healthcare means in this day and age. Why is this a topic that matters to me? Well, for many of you who know me and have been with me on my journey, you know that I'm here largely because of preventative health. My early detection of cancer genuinely saved, well, I don't like to say saved my life necessarily, because nobody's getting out of this alive, right? We all have a date in which this body transitions to another form of energy. I know that, but I want to get as much as I can out of this one. And being a person who learned early to advocate for myself in the healthcare system and understand the challenges and the excuses that I was not going to use or lean on, that's why I'm still here and was able to get treatment that not only keeps me here, but makes the quality of my life better, right? Because as I always say, you know, people always tell me life is short, and I say, yes, it is, but it's terribly long when you're miserable. And if you've ever struggled with a major health condition, you know that it can be quite difficult. So how do we avoid that? And in the conversation of emotional intelligence, I want to say it's an exciting time to be alive. We have witnessed unprecedented advancements in science and technology that have the power to revolutionize healthcare as we know it. And the reason why that's connected to emotional intelligence is because you need to be aware of the things that help make you better for society, right? One of the most promising areas of research is in the field of genomics, which holds immense potential for early detection and prevention of diseases. With the help of AI, we can analyze vast amounts of genetic data and identify potential health risks before they manifest into serious illnesses. By taking proactive measures, we can work towards a healthier future for ourselves and our loved ones. But it's not just about early detection. AI can also help us develop more personalized treatment plans based on individual genetic profiles. With a deeper understanding of our unique genetic makeup, we can create targeted interventions that are more effective and less invasive. I'm going to tell you, I've seen this in the cancer community extensively in ways that would blow your mind. But perhaps the most inspiring aspect of this work is the potential for social good. By democratizing access to genetic testing and AI-powered healthcare solutions, we can empower communities around the world to take charge of their own health and well-being. This technology has the power to bridge gaps in healthcare access and improve outcomes for populations that have historically been underserved. So let's embrace this exciting time of innovation and discovery and work together towards a future where everyone has access to the tools they need to live their healthiest, happiest lives. Together, we can build a world where technology and science are used for the greater good of all. And our guest today is leading one company on their journey, and he is here to talk about that. So let's get him on. Johannes Bhakdi is the founder of CEO and Quantgene, with the mission to extend the healthy human lifespan by a decade within a decade. Together with Quantgene's team of scientists and engineers, he is dedicated to introducing cloud, AI, and precision diagnostics into the standard of care to enhance quality and accessibility of care for everyone and protect human life. Born to scientist parents, Joe grew up with a backdrop of medical research before earning a master's in economics from Tübingen University, one of Germany's leading academic institutions. Prior to Quantgene, Joe held executive positions at BDDO and Omnicom with a focus on business model innovation and technology. Then founded I2X, an investment platform that provides quantitative analytics genomics tools for biotechnology and technology portfolios. Such an incredible person. We're so happy to be here. Everybody, please welcome Joe Bhakdi. Hello. How are you? Thank you for being here today.
Hi, Alina. Well, I'm great. Thanks for having me.
Are you enjoying the rain? I know it's a rainy day today.
It's it's always good to have some surprises here in LA. So
it's very Germany, right?
Yeah. Reminds me on home.
So let me ask, first of all, I have to say this for the audience, and I actually have to say this for yourself. When it came to inviting you onto the show, I recently attended an event that Quantgene held, and something that you said struck me, and I want you to know that. And I know we always talk about, our words leave impressions on people. So in the presentation that you were giving, you were talking about an amazing product that Quantgene is rolling out, and you said this is for, you were speaking and you said this is for every citizen. And then you corrected yourself. You said this is for every person. This is not about the rich people who always get everything. This is about everybody having an opportunity at preventative health. What drives you, as in this day, after everything that you've done, what drives you right now in your mission behind founding and running Quantgene?
Yeah, that's an amazing question. I think what we are facing right now is a very, very unprecedented level of revolutionary potential in medicine. I think what genomics does in conjunction with, new hardware, chemistry, but also AI and cloud innovation is so much bigger than most people even can imagine right now. It's truly the deepest, most fundamental transformation of medicine that we have seen in a very, very long time, maybe since its inception of modern medicine. And the reason is that suddenly we have literally millions of times more data on your health. And when I say millions of times, that's not a metaphor, it's quantitative. When we, get a blood sample and we do multi-cancer detection, liquid biopsy, it's a very new technology. We get, 10 billion data points out of each sample. So the technology is here to detect all cancers at early stage. The remaining problem now is economics. It's too expensive. But when I say too expensive, I mean, if you can afford $3,000 a year out of pocket, you're done, right? You have that technology under control. It takes another 24 months or something to really be near perfect, but it's already pretty effective. I think a very good strategy, how we look at the cost curve and the adoption curve, how can we accelerate the advent of universal precision genomics for everyone? In the end, it's about resources, right? You need to get it to people. And in order to make Medicare, Medicaid, even commercial payers pay for this, it needs to drop below a certain threshold. We have now this unique opportunity to take these new genomic technologies in conjunction with AI and cloud and figure out the leanest path to really scale them, get adoption, and bring this genomic age to everyone. Cancer is one of the biggest scares, and my family is affected, most families are affected, that you can have. And imagine that is gone. It's gone from the equation because you can be sure that every year you get a genomics test that identifies active tumors in you so early that you can nearly always knock them out and be cancer-free. Mm-hmm. That's the future that is guaranteed to come. The question is it here in 20 years? Is it here next year? Or where in between?
Right.
And that question is not a technological question anymore. That is a question of how smart are we as Quantgene, we as a community, we as a society, to find the leanest economic path.
Right. Right. When it comes to preventative health, there's a lot of excuses. You mentioned one being finances. I don't have the money to go to the doctor. As the leader of this organization in some of multiple different products, obviously, with the background, you can go on the website and look at, during COVID, there were things that you were able to come in and support different industries, get quicker lab results and things. And then you also have products that started to help people determine future potential risk factors, right? Maybe I am a highly considered for diabetes or heart conditions or cancer. Outside of cost, what have you observed to be some of the biggest resistant factors for people to even going and, following through with their preventative healthcare? Outside of cost, what are some of the other excuses that they lean on?
One piece of the puzzle is, okay, you need to take more responsibility for your own health and your family's health and be proactive. But on the other side, someone smart, I forgot who it was, said that civilization is just the establishment of infrastructures that make it superfluous or unnecessary for you to do certain things because they're automated. That's all there is.
Sure.
Basically, the cavemen were the same people as we are, but they didn't have all that stuff.
Right.
And so the only difference is now we have automated stuff. And in preventive care, that's the mission of Quantgene too, besides the cost curve, to make it seamless. Like it should just be automated. It should be your buddy on the phone that says, Alina, by the way, you should get your mammogram now because you're a little late, or your blood cancer test, whatever it is. And that's really missing, unfortunately.
Right.
And that's kind of a weird thing because that's not even hard technology.
Right.
It's not super easy. It's a little harder than it sounds, but it's also not deep genomics.
Right.
Like, why can't we have reminders in a seamless way that help you not fall through the cracks? And to give you an idea, like 92% of all Americans don't get the preventative care they need,
right,
according to guidelines.
That's why we're having this conversation, because they're not. And why do they need to so badly?
Very simple. So what we just discussed, right, the future of medicine and genomics, this is kind of the future in the sense that we can give it to you now, but it's not officially guideline encoded. Most physicians don't even fully know that. When they look at the data, they get it, but it's not implemented in guidelines. But there are things that are implemented in guidelines. Get your A1C tests, right? Get your lipid panels for cardiovascular, get your cancer screenings. Get them in certain increments, time increments. That is all fully understood. It's understood in a way that protects your life. It's understood in a way that saves money to the system. There is no downside. There's only upside. Yet, only 92% of Americans don't get that.
Right.
And it's very important because this is the simplest, easiest, and most proven way to protect your life.
Right.
You can literally translate that into a percentage number, how much additional risk of death you take on per year. I mean, it's the most unnecessary thing you can do.
It really
is.
is.
Smoking or driving without a seatbelt. It's just proven to not be smart.
In a time when longevity is a thing, right? I remember last year reading an article that lifespans had increased, right? Over time, studies had shown we were living longer because of things like yoga and emotional intelligence and advancements in health and wellness. But now, since the pandemic, and I'm not actually quoting the studies, so just anyone who's out there, banking on this, know that I have to. But at the end of the day, the study was indicating that now, since the pandemic, we're seeing a reversal in those numbers, right?
Yeah.
So I'm assuming you know what I'm speaking to. So with longevity being an issue and people wanting themselves and their moms and their dads to live longer lives, I see and value how you really want to impact those communities. Tell me, how does the company approach addressing health disparities and ensuring that underserved communities have access to these life-saving technologies?
I think in addressing this problem, you have like 3 key levers, and this is all connected. Number one, we have kind of 2 arms to the company. One is pushing the frontiers of medicine by bringing self-payer, the more premium price services to you, where we basically say you can have an accelerated access to the future, because we don't have to figure out before we give it to you complicated things with Medicare and with Blue Shield and United Healthcare and everyone to figure out how we exactly save money. We can say, well, let's save your life first. You pay a little more and you get it now. That is very important because that helps us to understand the exact economics that then need to be argued into the system. At the same time, so this is very important because if you don't do that, it's like Tesla. If Tesla doesn't build a car for wealthy people first, they will never build a car for everyone. Because that helps them to understand what's going on, to streamline manufacturing. It's not just, when we talk about health access, we often think about, we need to be better people, not be so greedy, ABC. That's not really how it works, right? You need to, the key, and that's the second piece to the puzzle, is innovation. If you don't innovate, no one can afford rolling out a giant system that bankrupts the United States. That's not beneficial for anyone. So we need to figure out how to do it. It's about being pioneers and building these systems. So you start here with more wealthy people who can help finance figuring that out, while at the same time we are driving innovation to bring down the cost curve. And then as a third point, have the will and the motivation. That's where the last thing comes in. to actually plan that out as a system that needs to get to everyone in the shortest amount of time. And I think all three are important. You need to push the frontier. You need to understand that there's only one solution that brings equity to everyone. That's not politics. That's innovation. Because if you can't make it happen,
right,
you can complain all day. It's not going to work. So that's important. But the third piece is the will and the intent to actually make this happen.
Right.
Which is unfortunately behind the scenes in healthcare often missing. It's too much about the greed comes in a little bit. It's about who cares, like I want to make a lot of money. That's the wrong attitude. And you need to combine economic soundness with the ability to innovate and the will to drive it to a point where this becomes basically accessible and free for everyone.
Absolutely. Absolutely. I could not agree more. And I think that, you hit on something you reminded me of a thought I had earlier about how, pharmaceutical companies are on everybody's, pardon my French, I'll spell it out, SHIT list. Everybody, they're on that list, right? They're on the, we do not like you list. You're, overcharging. And again, going back to what I loved about hearing you speak and hearing the message that you champion is that, yes, if you are the person who can afford, this, that's great. But we still want to create a model that allows everyone, the people, to get it. And which is a show of integrity because the pharmaceuticals, they want you to get sick. Well, that's the theory, I should say. The theory is they want you to get sick. I know I'm not going to. They want you to get sick because they want to milk you on the back end for the cost of getting better. So sick society makes a wealthy pharmaceutical company or industry. And what you're doing is literally trying to cut in front of that. You're not saying, yeah, I want to make you spend a lot of money. You say, no, spend some money to actually not have to hopefully have some of those healthcare issues down the line. And I completely appreciate that. Can you talk about some of the key milestones that have been achieved thus far in advancing the goal of early detection and more effective cures for all diseases?
Absolutely. So we had some very important breakthroughs, us and our peers. I always hate to talk about competition in this space because we're all trying to do the same thing, right? So we are always grateful for any competitor who is first, right? Because this is about, first of all, even economically, we all benefit from advancing the field. But also, I think it's terrible in healthcare when you say, I have this drug. This person has the other drug. Let's try to find out how we prevent patients from getting that drug. So they have to take ours. I mean, that's exactly what we should avoid, right? To not get into that. And we had great breakthroughs in 2018 where we showed this works, multi-cancer detection in the blood. We had a paper out back then. And it was very clear, okay, this is the breakthrough. This is working. And then other people also came out. So it became clear the industry in 2018 was at the point where it becomes, without any doubt, you will detect cancer in the blood, early stage across all cancers. And then it was just a question, okay, how long does it take to bring down some costs, improve some performance?
Going to the AI aspect and in the vein of what you're talking about, sometimes people can go to a doctor and they can say, well, my mom had colon cancer or breast cancer. Actually, I'm going to cite a very specific case that I know of, a friend of mine who is a fellow cancer survivor. Her mother passed away from colon cancer and at an early age, unfortunately. And she went to the doctor about 25 years old. And she says, my mother had passed away from colon cancer. Should I be screened? And the doctor made his determination. No, you should wait 5 years. She got a second opinion. And that doctor said, absolutely not. You need to have a colonoscopy. When she woke up from the colonoscopy, the doctor told her, if you would have waited those 5 years that initial doctor told you, you would have already been dead. You had so many polyps and she had suddenly had to go through treatment. So why I'm saying this, AI and the technology that you are behind, it kind of takes out this personal aspect that physicians can sometimes do. And I'm not bagging on physicians, but they're not superhumans, right? They've gone to school, but we're very complex individuals. And a lot of time what they can dismiss, unfortunately, can impact our lives. So the technology with the AI, and explain that a little bit more, how that removes the, what I'm going to say, emotionally unintelligent aspect of what physicians and human life like. How does that reinforce or how does that protect us and give us an advantage when it comes to preventative healthcare?
probably my favorite topic is that. So first of all, when it comes to AI, I always like to rephrase it to MI, medical intelligence.
Okay.
Because no one cares if it's artificial, not artificial. You want a system that is foolproof and knows everything.
Sure.
However it does it. There might be neural nets, machine learning. There might be also hard-coded algorithms. So there might be hybrid human things. So you need to see intelligence as the objective, not like one specific type. But it needs to be cloud-centric and centralized. And so here's the problem. First of all, there is no such thing as magic. Like physicians are humans. Humans have eyes, they have ears, they have a brain. They see something, they query their brain, what it means. Their brain knows something. You don't know what they know. You don't know when they went to med school. You don't know how much they read. You don't actually want that in the future. You want a foolproof system that knows thousands or millions of times more than a physician. It has to be like that. And, believe me, we work with a lot of physicians and have many physicians on the team. And I love them all. And they help build these systems. They think the same as I do here. It's very simple. You need to maximize data input into the machine, into the system. The system needs to have all knowledge at all times in real time. And the system has to draw the right conclusions. Before we even determine what the system is, that's the goal. And the good news is we can get infinitely closer now to that system than an individual physician. If you work with us, you actually work with physicians, but we have a much more systematic intake of data. This data is fed into the core intelligence. The core intelligence is in the cloud. It's connected to all medical knowledge, all guidelines. It's updated in real time. So we will know exactly what's appropriate at what point. I shouldn't say exactly, we just know much more.
Right.
And then we determine, there are a bunch of red flags. Okay, potential family history or proven family history for colon cancer. How bad is it? What guidelines change is implied? What other data points do we have? Do we have genetics on that person? Then, what are the downstream recommended diagnostics that are best for the patient? So colonoscopy, of course, gold standard. If it's a little more unclear, maybe blood cancer test, much easier. Maybe a FIT test, right? A stool test, much easier. So you can then do that. And that's how the future of medicine looks like. And that's what we deliver today. We hope soon at lower prices, but that's what's happening now.
And that's so, it makes a difference. One of the previous businesses I've owned, I'm sure my audiences love listening to my backgrounds, but I was actually one of the implementation advisors for the California Medical Review Board, a project called the Doctor's Office Initiative, Doctor's Office Quality Initiative, IT. And our role for California being the largest state with the most doctors, and then continuing from that being an example to the rest of the United States, was on, information technology. Even just that. We're not even talking about, what people perceive as the MI and the AI models, but still medical intelligence data, because data is king. I love that you keep talking about data. I'm not bored because it makes a difference. You have to pay attention to that. But it was such a challenge to get people to understand at times the benefit, like a client or patient going into an encounter, and then maybe the doctor recommends a prescription, but they don't know there's a cross counter of another physician's doctor's medicine that they've been prescribed. And the whole reason for that intelligence is to prevent that, that mistake, that error
that
from occurring.
Me also to another point that is connected to this.
Tell me.
It's a direct message to the audience.
Yes, please.
I know we all have this instinct, especially in medicine, because we feel so vulnerable by definition, right? Mm-hmm. That's how we can get sick. That's how we can die. And the instinct is the most terrible instinct that all of us have. It's to give up responsibility. To say like, oh my God, I can't deal with it. Please, doctor, take care of me. That's how you get killed. Mm-hmm. Not just in medicine, but in general. The more important things are, the less you can bury your head in the sand. And we work in 3 different verticals. We work with research, right? We work with payer-provider systems to try to convince the systems to implement it. And we work with kind of self-payer concierge. Mm-hmm. And my message is always, if you can afford it, first of all, you should try to afford it. If you can afford it, get out of that system and pay for your own health and make your own decisions. Because we are doing our best, believe me, to make it all in the system. But the obstacles and the ridiculous thing from your perspective, who wants to not die, right? Who wants to be safe, to rely on us having negotiations with Medicare and Blue Shield and Anthem and all these people who are all good people, but they have to ask their bosses, they have to ask their investors, then they have to go back to the system. There are committees and committees and committees. And say, oh, but this costs $600, absolutely unacceptable. Bring the price down to $369 and we can roll it out over this cross section of the population.
Right.
If you are sitting here in LA and say like, I'm scared of cancer, I might have, do not wait 15 years to have them figure out how to decrease the price from $650 to $489.
Right.
That's not a good decision.
Yeah.
So that's just my message. And to your point, also you as a patient, when it comes to data, own your data and find systems where you are the captain of your health, and physicians should be advisors and nothing else.
Yes.
That's what I always tell them. Your lawyer, your financial advisor, your physician might be the most important people, but they all have the same role. They need to advise you. You don't want a financial advisor who takes over your finances and say, you know what, don't worry, I manage this stuff. You don't need to know what that is.
Right. Agree.
I always say, try to not die, not go to jail, and not lose all your money. Then you're pretty good. And these are the three institutions, same with the lawyers, right? Listen to them, form your opinion, try to understand what's going on. And most importantly, in medicine. And I think if I have one message, please, everyone, seize control of your health, starting with yourself, and find the right advisors and systems to do that for you.
Yes. Yes. And I love that message. I think this is a quote from your site. Our vision, actually from you, excuse me. Our vision is what I call 10 in 10, to extend the healthy human lifespan by a decade within the next decade by accelerating the advent of precision genomics for everyone. So looking ahead, future of preventative healthcare and genomic analysis, what does that look like to you? And where do you see yourself coming in?
I think the future is very clear, outlined, right? We have now the systems kind of priced competitively, ready to roll out precision genomics in preventative care, which means a blood test and some basic tests once a year, starting with 40 probably, depending on your risk profile. And we can detect all cancers early stage in the blood. Of course, not every single cancer all the time, but at a very good rate. That is the system we need to roll out. That is connected to medical intelligence, so we understand what it means in your personalized context and draw the right conclusions. Now we have a solution that's ready. It's all about how can we increase adoption. The higher the adoption, the lower the price. And, for me, this really becomes a different problem. It's not science and medicine anymore that has all been solved. It is about economics, but maybe more interestingly, it's about us as a community. Can we find enough people who get it, who want to get it, who think about their health, who are not burying their heads in the sand and say, well, I don't have cancer right now, why would I care? It's like, the whole point is you should care, so it doesn't happen, or if it happens early and you can do something. So it becomes it becomes a problem of, can we be good stewards of this mission, go out in the world and try to explain it to people and try to build this tribe. Mm-hmm. The tribe of people say, I care for myself, but I also care for my family, and I care for us being these pioneers who can bring that to everyone by just using it. Yes.
Yes. I mean, that honestly, that is so important. That is so key. I kind of want to ask the question to some extent, like, people get up every day and they love what they do. Do you love what you do right now because of the impact? Like, I know I said early on what drives you, but every day when you're getting up as the CEO of Quantgene and you see the future and you see what's happening and you know that you are creating this social good, like, just taking a second to talk about how it personally impacts you. Can you share that with us?
Yeah, absolutely. It took me a long way to get here, even to start Quantgene. But I'm incredibly kind of grateful that fate got me here, because in a way, even though it's not easy sometimes, you always need money, you need to talk to investors, sell them, people have problems, you get, there are all kinds of issues when you run a company. But the ability of, the possibility that I have been given to actually do something about this with a great, amazing team that really built something that didn't exist before. And now the opportunity to talk really to everyone. We just had a conversation with the former Secretary of Health and Human Services. So everyone from the top in healthcare to amazing people like you, right? Who push the frontier and unsugarcoat everything. And concierge docs, very smart. And it's just like this feeling that we can do something about such an important topic, that we are not passively just sitting there like, oh my God, I hope I don't get cancer or die of another disease. It's just the best thing ever. And it's not easy, but it's like an incredibly gratifying journey. And I hope we can take it to the next level now to really build a community around it.
Mm-hmm. Mm-hmm. I know that you are. I've seen it. I've experienced it, and I'm happy for you. I mean, you've shared your message. You've shared your heart. I do want to thank you for that. And, with regards to we're going to still do a couple rapid fire questions for you, but, for people who are interested in supporting Quantgene, following along, or even adopting some of the amazing projects that you have coming out, where do they go?
So first of all, I'm more than happy. You can always write us emails directly at, even to me, jb@quantgene.com. I love to hear from people back, like, what do you think? Right? I'm really trying to be at the pulse. So at this point, you think, it's such a, you have all this genomics technology and all these labs and you're the CEO. I think you should not be. I love getting direct feedback from people because you never know, right? Just write me and tell me what you think. I love it. Then you can go to quantgene.com. That's the basic website, and to choose serenity.com, where the Serenity product is positioned. And I can just encourage everyone, just reach out. Our mission now is to build the community, because that's what we learned throughout the whole journey, from clinical research projects to talking to payers and providers to launching the concierge side of things. We have to do this together, and we have to be a community. Like, this is more than just a business. This is something that can save your life, my life, and the technology is here. So we need to do something about it, because all the hard things in a way have been solved. Maybe the hardest hasn't been solved yet, which is building a community and really getting people excited about it, adopt it, help more adoption, bring down pricing, get it to everyone.
Right. And remove those excuses that we lean on, right? Because, I get it. I will say, my mother-in-law were talking about that the other day. Being sick can kind of be like a part-time job. You do have to go to the job part-time, full-time, depending on what level you are. And I think you're right. And I just love what Quantgene and what yourself and what Fred, I know over, and what all of you guys are doing, your entire team, because I agree with you. It is about taking a proactive role. Even with my own journey, I just recognized, I remember having a doctor one time say, well, we'll wait and see. And I, with all due respect, doctor, I'm the one who's got to go home and kiss my kids at night. Yeah. I'm not going to trust wait and see. Yes. We have technology available, so let's use it. Yes. Right? So that I can make sure. I appreciate you, and I look forward to seeing you again. Thank you.
It was a pleasure. Thank you, guys.
And to you at home, well, let's see. That not just wraps up another season. And that doesn't just wrap up our another episode. That actually wraps up the end of our season. So we've talked about emotional health. We've had incredible guests, as I've said. I'm reminded of the incredible power of human innovation and collaboration by our conversation today. Today, we explored the intersection of AI, genomics, and preventative health, and saw how those fields have the potential to transform healthcare for the better. As we move forward, let's continue to push the boundaries of what's possible and work towards a world where healthcare is accessible, equitable, and effective. Let's build bridges across disciplines and communities and harness the power of technology for the greater good of all. But it's not just about technology and data, it's about people. It's about empowering individuals and communities to take charge of their own health and well-being and working together to create a brighter, healthier future for all. This season has been sprinkled with the components of emotional intelligence, empathy, self-regulation, self-awareness, motivation, and social skills. And while I hope you have enjoyed this season, I hope more than anything, you're left wanting more for yourself, for your family, and for your community. You are capable, you are worthy, and you better be unsugar-coated. We love you. We appreciate you. Until next season, thank you for letting us be unsugar-coated.